Dr. Grover, you are the man that we come to for vein care here in the Valley, and I understand you work closely with the Cache Valley Specialty Hospital.
I do. Today we're actually standing in the lobby of the wound clinic, where a lot of people that have vein problems will end up because of the chronic venous insufficiency problems.
And the wound clinic here is an amazing clinic. We're so lucky to have them here in the Valley. Tell me a little bit specifically, what do you look for, or are they coming here for, and then how can you help?
Most people will start having leg aches and pains. Sometimes they don't really attribute that to a vein problem, but then it will start developing into further problems. You'll see the varicose veins, and you'll start getting skin pigmentation changes of the legs, and even one leg will swell more than the other, and it can lead to ulcers on the leg, and that's where a lot of patients actually end up in the wound clinic because they now have wounds from the veins.
So to even prevent the ulcer, can they come and see you first if they're having those aches and pains, and can that be preventative?
Yeah, it can be a preventative thing as well. As long as there's disease, most of the insurance covers it. So we document that there is disease. We jump through our hoops with the insurance companies to make sure we've covered all our crossed all the T's and dotted all the I's, and then we can go ahead and get that treated and hopefully prevent further problems such as the wound ulcers.
Well, and that's, I guess, the most highest level of pain or whatever that could happen. But if you just have spider veins and then varicose veins, you can help us out.
Yeah, we do complete vein care, whether it's a simple spider vein injection. If you don't have significant disease in the deeper veins, we do vein injections for the spider veins. Those are more of a cosmetic issue. The insurance company unfortunately doesn't pay for that, but then other underlying vein issues, we treat those as well. So a lot of people will come see me and they're complaining of pain in their leg, and it turns out it's related to veins, and they don't have the ulcers and some of the chronic things that develop.
Exactly. Well, and the cosmetic part of the spider veins, you've helped me with my spider veins. It is worth every penny, can I just say? So whether insurance is covering or not, cosmetic things are important to us as women and even men, but to make sure you're taking care of those varicose veins before they become a real problem is, I rather think, important.
Yes, that's what we're after. And when people come to see me, I try and educate them about what's going on with the veins, which veins can be the problems, all the different things we can do. But the real purpose of me taking care of them is, let's get your symptoms under control so that you can function, so you can go to work and not have to worry about, oh, my legs are starting to ache, I got to stop and put my legs up before I can do whatever I need to do next, and things along that line.
We ought to explain this little gadget you're holding on there. Tell me a little bit about this.
This is actually a treatment catheter. It's used to treat perforating veins. It's the only thing that's FDA approved for treatment of perforating veins. It's radio frequency, and the heat element that we heat up the vein with is just these little two silver rings. It's very small, so it's very localized in the treatment. It's very controlled. We put that into the vein using ultrasound guidance, tilt it so that we're touching the vein walls, and then we can heat up the vein walls and scar those veins down so they quit causing problems.
Well, I highly suggest Dr. Grover, Scott Grover, here in Cache Valley and working with the Specialty Hospital. Tell me how they can get a hold of you.
My office is in the Logan Medical Complex on 1400 North. My phone number is 752-7123.